My name is Kelly Richardson, and this is my psychology and film assignment. And for this assignment, I am doing the movie The Black Swan. The Black Swan is a movie that follows the character Nina Sawyers in 2010's New York City. Nina is a ballet dancer and earns the role of the Swan Queen in the ballet Swan Lake that her company is performing. Nina lives solely with her mother. However, her mother still treats her like a child and is extremely controlling. Throughout the film, Nina is shown to be a perfectionist and have an eating disorder, shown by Nina practicing until her toes bleed and rejecting a celebration cake from her mother. The man who is running the production of Swan Lake, Thomas Leroy, sexually assaults Nina and pushes her to her limit in rehearsals, adding to the increasing stress and pressure of the role of the Swan Queen. Within the dance company, Nina also has a rival, Lily, who embodies the black swan and the part of Nina that she is yet to achieve to reach perfection in the role of the Swan Queen. There is also the character of Beth, who used to be Tomas's star ballerina and was cast aside for Nina. Beth's character gives Nina a scary glimpse of what her future could look like, and it frightens Nina to the point of attacking Beth and seeing herself within Beth. The fear of not being perfect, the eating disorder, the constant stress of her mom, led Nina to break down from the stress and start seeing hallucinations. Nina is paranoid that someone is trying to attack her, which is symbolic of the black swan version of herself, killing the innocent white swan version of herself. The hallucinations progressively get worse until Nina stabs who she thinks is Lily, her rival, but ends up being herself. Diagnosis. I would diagnose Nina with either schizophrenia or brief psychotic disorder. However, we cannot determine which one it is because Nina dies at the end of the movie. Sorry, it's a spoiler. It could be brief psychotic disorder, which was onset by stress, or it could be schizophrenia that was brought on by the diathesis stress model. For my diagnosis, I'm going to choose schizophrenia. I would say that Nina has the persecutory type of schizophrenia, in which the person is convinced that they are being followed, conspired against, or spied on. In the culture around the film, Nina most likely would not have been taken seriously, and she definitely would not have seen a therapist in the first place, so she did not risk her spot at the company. Especially in sports, the tough it out mentality is what many athletes live by, leading them to ignore or push down their problems and issues. Schizophrenia can be hard to diagnose across cultures because different cultures view the self in different ways. Western culture is very individualistic, which can lead to the proper or overdiagnosis of delusional disorders. Eastern cultures are very collectivistic and might not recognize schizophrenia in a person, which can lead to underdiagnosis. The stigmas that people with schizophrenia are crazy or that they are lazy because they cannot work are very harmful and stem from a misunderstanding of the disorder. The stigmas mark people with schizophrenia as outcasts who cannot function in society, which is not true. Evidence. Nina displays hallucinations and delusions. Hallucinations are perception-like experiences that occur without external stimulus, while delusions are fixed beliefs that are not amendable to change. Nina displays hallucinations when she imagines herself growing wings and becoming a swan. She experiences delusions when she thinks that Lily is trying to kill her. Nina does not present catatonia, which is a common feature of schizophrenia. However, according to the DSM-5, for a person to get diagnosed with schizophrenia, they have to present 2 or more symptoms that persist for at least 1 month. The DSM-3 is an earlier version of the DSM-5 and details the criteria for diagnosing schizophrenia. It was then modified and edited to clarify the 6 criteria, and Nina fits under criterion A, which specifies the characteristic symptoms of schizophrenia. Treatment. The current antipsychotics used to treat schizophrenia only treat the positive symptoms, which are hallucinations and delusions, but do not affect the negative symptoms, catatonia, social withdrawal, and learning disorders. The antipsychotic drugs are usually antagonists of the dopamine receptors and serotonin receptors in our brains. However, 30% of patients do not respond to the drugs. As of right now, there's no for sure good treatment for schizophrenia. I would put Nina on an antipsychotic drug with a good support system to help her with hallucinations and delusions. And if that does not work, I'd put Nina into different drug trials, with her consent, of course. If she does not respond to any of those treatments and gets worse, I would put her into an institution. The problem for Nina in this situation is that her mother would not support any treatment options for her and would be a very harmful support system for Nina. Nina would get worse with her mother, and if she continued dancing, which we saw what happens in the movie, when she continues both of those, she dies. The ethical concerns would be the experimental trials she could participate in, and if they are done correctly, or the safety of the institution I would place her in. Broader perspective. I would say that this is an accurate portrayal of schizophrenia. Nina was extremely confused and disoriented by what she was experiencing, and she could not distinguish what was real and what was not. Nina's symptoms also began after a combination of extremely stressful factors and events in her life. I think that this is a good portrayal of, I think that this portrayal of schizophrenia has both a positive and negative influence on the general understanding of schizophrenia. The movie does a good job of portraying the confusion, how the disorder does not have to be just scary voices, and how badly the disorder progresses to the point of suicide. However, not all schizophrenia cases have negative delusions or hallucinations, and it can present as very calm. The media always shows people with schizophrenia as crazy people who have no control over their thoughts, while there can be people who live normal lives with schizophrenia. In any context, schizophrenia will most likely be perceived as a disorder, but in some cultures, people with schizophrenia might be perceived as a prophet, a medium, or someone who can contact spirits. Overall, this movie did a good job of portraying the disorder, in my opinion. Here are my sources.